Hi, and welcome to MansMatters, the Erectile Dysfunction Shockwave Clinic. Today, I want to talk to you about erectile dysfunction and pornography, and the increasing body of thought that believes pornography can be a contributory factor to erectile dysfunction. Pornography, in different forms, have existed for at least 3,000 years, dating back to ancient collections of carvings, like the Kanja-Shemenji petroglyphs in China, through to discoveries of precious papyrus in excavations of pyramids in Egypt. In some cultures, pornography is considered a taboo, whereas in others, like ancient Roman and Greek cultures, pornography and sex were intricately intertwined with religious beliefs. But today, we are faced with a totally new age of pornography, an age where pornography of any type and fantasy is just seconds away at the touch of a button on a phone or tablet. And, shockingly, it is so easy for boys just reaching puberty to access pornography, meaning for many youngsters, their first exploration into sex doesn't start with peering at a top-shelf magazine like the old days, a fumbled kiss or holding a hand, but with hardcore pornography. Opinion is divided whether pornography contributes to erectile dysfunction, but increasingly our clinical experience suggests there is a growing link, and it is not just erectile dysfunction, the ability to have satisfactory penetrative sex, but also a wider range of psychological and partner issues. A recent study of over 3,000 men of different ages established that there was a correlation between the amount of pornography watched and an increasing incidence of erectile dysfunction. And, very worryingly, this showed that an increasing percentage of young men in their late teens and early 20s were complaining of this. Our clinical experience suggests there are a number of reasons for this. One is a desensitization to sexual stimulus and an increased need for more and more erotic stimulus. Stimulus starts with the senses, sight, touch, or smell, but especially sight. So, in the past, a female in a low-cut top may have triggered an erection in a young heterosexual male. His eyes were telling him to become sexually aroused. But nowadays, the mystique is gone. There are no surprises for a young male. We are now seeing an increase in pornography addiction, where males can watch hours of pornography and become experts in self-pleasure, rather than a mutual pleasure enjoyed between two partners. In fact, if you are an avid pornography watcher, try and make a note of just how much pornography you watch in a week. Some men would be staggered to realize just how addictive it has become. Pornography addiction leads to problems in the bedroom for both partners and increased expectations that cannot be fulfilled. In fact, a new term has emerged in this digital age of partnered sex. Put in simple terms, pornography has made expectations higher and self-esteem is lower. For young males, their manhood is intrinsically linked to their masculinity. In the past, they would have envied the alpha males at school who attracted the attention of the pretty girls, but today, their mental competition is the male porn actors with their fit bodies and oversized manhoods. For a man, the expectation of themselves are higher, and when they can't get aroused with their partner because the bar for stimulation has been set so much higher, it becomes a vicious circle, and problems with getting and sustaining erections start becoming more commonplace. Similarly, their partners may also feel they cannot compete with porn actresses who have been filmed in erotic lighting, effortlessly performing sexual aerobics with seemingly perfect sexual bodies. So, just like people who drink too much alcohol, smoke too many cigarettes, or live off a bad diet that could lead to health problems, men who watch too much pornography and are experiencing erectile dysfunction need to do something about it. Whilst there is no set medical protocol with do's and don'ts, these are some of the things we advise our clients. Firstly, set yourself a target to stop watching pornography for 90 days. If you struggle with this, it is an indication of how addicted you are. If you are older, remember it is only in the last decade or so you have been able to watch pornography and you lived a fulfilling life before this. To help with this, download pornography blocking software. If not, the temptation may be too great to slip back into viewing. If you struggle, make a list of the reasons why you shouldn't be watching pornography and how much of your life it is taking up. Increasing your chances of ED and problems with sexual intercourse with your partner are right up there on the list. If your struggle is too great, consider contacting a sex therapist to help your pornography addiction. At MansMatters, we treat thousands of men with a range of sexual problems, from erectile dysfunction through to Peyronie's disease. Our most sought-after service is our program of extracorporeal focused shockwave therapy, enabling men with erectile problems to discover satisfactory sex again. To learn more about our shockwave treatment, visit our website at mansmatters.co.uk and check out our video, Erectile Dysfunction Cure, which provides a comprehensive overview on all treatment options and a detailed animation of the shockwave therapy.